Hello everyone, welcome back. Today's episode we're going to talk about Transient Ischemic Attack, TIA. It's a very frequently term used by normal person also. We get lots of queries, people asking, I got supposedly some TIA, whether I need more evaluations, whether I need admissions or not. You see, earlier TIA was defined based on the durations, like up to 24 hours. If I'm having some weakness and I have recovered within 24 hours, it is said to be TIA. This definition has been changed now because we have seen over the years that up to 50% of patients who were within this 24 hours has recovered, but the brain has some sort of damage has already happened. So in current definitions, if somebody is having weakness or not able to see and the brain is or the corresponding spinal part of the retina is having some damage, although there is a complete recovery, it is not said to be TIA, it is a stroke then. TIA, somebody is having weakness and transiently having weakness and recovered completely and without having damage in that area, in the brain, spine or your retina. That's a TIA. Okay. So the question is, how should we take it? Any seriousness? If so, what we should do in this admission or not? You see, TIA or transient ischemic attack can be high risk, can be low risk as well. So we do a scoring system that is called ABCD2 score to know how severe, what is the high risk of having recurrent TIA or a stroke. ABCD2 score, that stands for, as shown over here, is age more than 60 or less than 60. Is there any hypertension? What is the clinical features only in the right side or left side or both side, and whether any difficulty in visions or not. Similarly, duration of symptoms, whether it's less than 10 minutes or more than 1 hour, something like that, and diabetes associated. Is there any association of diabetes or not? So all this scoring, if the score is 4 or more than 4, then it's a high risk TIA. Saying so, it means that there is a chances of recurrent TIA or stroke. So these persons definitely need more evaluations and sometimes admissions, of course. And also antiplatelets is being prescribed, maybe one single antiplatelet or maybe dual antiplatelets based on the severe. We need to see how is the artery supplying to the brain, how is the heart status, and all these things we need to be evaluated for these patients. Okay. Whereas if it's a low risk TIA, that can be evaluated on the basis of OPD basis. You can do that evaluations. But if it is a TIA, I would say it's a red flag sign. I repeat again. If it is a TIA, it's a red flag sign. It's a warning sign to have recurrent strokes. That definitely needs evaluations and treatment. Don't take it lightly. At the same time, there are some conditions, which can mimic like TIA, transient ischemic attack. Say for example, somebody is having numbness in hands. Very frequently we find that I'm having some numbness in hands and then transiently that improve. This numbness can be because of TIA also, or can be because of other things like neuropathy, diabetic neuropathy, or small fiber neuropathy, or it may be sometimes sensory. Seizure can give rise to this sort of problems. Some thalamic lesions can give rise to some sort of problem. Not necessarily it is in TIA. Some sort of vertigo, dizziness happening, and then that, especially if it's in positional dizziness, which may not be TIA and which needs to be evaluated for that. So in conclusion, if someone is having weakness in hands or limbs, not able to speak properly transiently, vision problem or limbs weakness, don't ignore it. This can be TIA, yes, this can be TIA, but this is a warning sign, this is a red flag sign, and to prevent further any damaging large stroke, you need to see a neurologist, you need to see a stroke specialist. So regarding this, any queries if you have, we will be very delighted to help you. Thank you very much.